Hello, my name is Dr. Stuart Yeager. I'm a chiropractic physician specializing in holistic health and wellness care. I'd like to talk to you about diagnosing of allergies. There's many different kinds of tests that you can use to diagnose allergies. I'd like to share with you a few of them. One of the least sensitive tests or specific ways to diagnose allergies, but it's a good indicator, is the CBC with the white cell differential. In that test, when you look at the basophils and the eosinophils, those white blood cells could be slightly elevated, and that's a good indicator that you may have allergies, but it's not specific for any kind of allergy at all. The skin scratch test is very specific. It's a good test. The difficulty with it is that there's a lot of things. Each test has to be done specifically, and it can be quite consuming because there's a lot of things that you can be sensitive to or allergic to. The other test is there can be a lot of false negatives, and it does not test for the autoimmune. The RAS test, or the radio allergen absorbent test, is a blood type of test. Again, there's a lot of things that can be tested, and literally hundreds. And the problem with that one is there's many false negatives, and also it does not test the autoimmune. The allergen-specific IgE or the IgA or the IgG tests are very specific immunoglobulins that are tested, and it could be positive for one test like the IgE test, but not the IgG or the IgA, or any of the tests could be positive, and so it can be quite time-consuming. This one can take several weeks to get a response to. The Alcott test takes, again, several weeks, but it's a very good test that can be done. It's not specific. It's not for any of the IgE sensitive tests. It's for the IgG. So, for example, gluten test is not. If you want to test for gluten and sensitivity, it is not a good test to do, but it's a very good test. If you can't find positives with some of the other tests. The challenge test is something that can be done at home, where you can introduce the allergen to your body, whether it be rubbing it on your skin or partaking that, eating that particular allergen, and waiting for a response within a couple of hours to a few days later. If it's a slower response, it's difficult to recognize that there is a reaction to occurring. For example, tendinitis and bursitis or arthritis can be caused by allergies, but you may not recognize it because it's a slower response. So there can be a lot. It can be a difficult test to do unless it's an immediate response. Again, it's difficult you can't test the autoimmune with this test. I want you to talk to you a little bit about allergy versus sensitivity. An allergy is a more immediate, severe response where you can notice the symptoms and recognize the symptoms, like a welt or a rash or something that is more obvious. A sensitivity is a more subtle response, as I mentioned, like with the bursitis and tendinitis and arthritis, those kind of symptoms, they can be more subtle, and so you don't recognize that you're actually reacting to that. They can definitely be very damaging with these sensitivities, and you may not recognize the damage until years later, like a damaged joint, like in the knee joints, needing a hip or a knee replacement. So they're very more difficult to recognize. And with the traditional testing, there's a lot of false negatives for this test. Autoimmune diseases are also very difficult to test with allergy testing because the way that it's done is through signs and symptoms, doing a good history, and then looking for things like inflamed joints, swollen lymph nodes, and discolored skin. But there is no specific laboratory test to test for the autoimmune disease. Now, with the muscle response testing, it's a very sensitive test. It's very quick, very inexpensive, and it can test for all three types of the allergic reactions. We're talking about the food, the environmental, and the autoimmune, because it's so sensitive. So it's a test that we utilize here in our office as we treat people with the 6 steps to wellness. We incorporate that as part of one of the steps to helping people get well. So we had a patient come into our office with chronic fatigue, brain fog, and depression. As we treated this person with the 6 steps to wellness, including for the allergies and sensitivities, their energy came back. Their brain fog went away, and their depression went away, and so they got their life back so they could function normally again. We want you to know that there is an answer to allergies. To learn more, you can go go to our video link on allergy treatment options, or you can give us a call at our office at 801-943-3355.